So how do you know if your baby's moving enough? There's a test that we call kick counts, which is a simple test that you can do at home that can reassure you that your baby's okay in times when you're not sure if it's moving enough. So let me talk to you about kick counts. Now there's different ways that people do this, and I'll explain the way I have my patients do it in my practice. Your doctor may have a slightly different variation on that. Listen to your doctor, ask him about it. But this is the way I tell my patients. If you're worried that your baby's not moving enough, drink a bunch of fluid, make sure you're not dehydrated. If you're not a diabetic, maybe eat something sweet or eat a little something, and then lay down somewhere quiet. No distractions. I don't want you watching TV or reading a book. I just want you laying down and concentrating on your baby. And then start noticing when your baby moves. You should have 10 movements. The baby should move 10 times in less than 2 hours. It doesn't have to be big, giant movements, just 10 individual movements. As long as you can feel 10 movements in less than 2 hours, your baby's fine and not in danger. And that's what kick counts are. Now, honestly, most people don't have to lay there for 2 hours. Most people, it's 10, 15 minutes, they're done. Most people never really have to do the test because if at least once a day you've got a good period of activity where your baby's obviously moving 10 times in 2 hours, then you don't have to worry about it. But if you're worried that the baby's not moving enough, that's a little test that you can do at home to reassure you that the baby's okay. In some situations, for instance, if you're diabetic or your fluid's low or there's other high-risk situations, your doctor may ask you to do kick counts every day regardless, and by all means do that. But in general, at least once a day, you should have a decent period of activity. Do know that the baby's movements tend to peak somewhere between 28 and 32 weeks. That's when they're the most active. Then they tend to slow down, and especially near term, the quality of the movement may be different. People tell me it's more of a rolling kind of movement or a stretching kind of movement than those kind of radical movements they were feeling at 28 to 32 weeks. That's normal and nothing to be concerned about, as long as you're feeling some movement. The other thing people worry about with movements is the patients will sometimes tell me that, gosh, the baby's moving so much I feel like it's having a seizure. Honestly, there's no such thing as too much movement. It may be uncomfortable for you, but it's how you know the baby's okay. So if the baby's moving, even if it's moving a whole lot, that's a good thing. It means the baby's healthy. And the way you know this is think about when you're sick. I know when I'm sick, what do? I lay on the couch and I just do nothing. Okay? When I'm feeling great, I'm full of energy, I'm active and moving around. Same thing with the baby. If the baby's in trouble and sick, it's just going to lay there. So if the baby's moving a lot, you know the baby has plenty of energy and it's doing okay. And so that's the concept of kick counts and baby movements.
Medtwice.com